Passing kidney stones is known to be extremely painful. This pain could put someone to bed without the possibility of going about normal activities and ultimately ruin the entire week. But how can you prevent kidney stone formation, and if you have them, how can you eliminate them quickly? In today's video, I'm going to reveal how to prevent and eliminate kidney stones naturally and effectively. Hey guys, Dr. Gus here, naturopath, acupuncturist, conventional doctor, and founder of drlandivhar.com. In this channel, as a conventional doctor, I treat my patients through natural medicine before recurring to the use of pharmaceutical drugs. So if you're new to my channel, consider subscribing and press that bell down below to see notifications and be the first one to watch a new video. If you need to line an appointment or quality supplements for your disease, visit drlandivhar.com. And I encourage you to stay till the end of this video, where I'm going to reveal extra tips and video links related to this topic. Kidney stones are made of many different components and minerals. These bind to one another inside the kidney, lodging and sometimes blocking the urinary tract, giving you that intense pressure and pain when going to the bathroom. The stone forms when urine contains a high concentration of these crystal-forming substances, which can include calcium, oxalates, phosphates, or carbonates. The most common types of stones, however, are calcium stones that once they form can attach themselves to places that block the urinary tract, and this becomes the primary reason for suffering that intense pain that many times is unbearable. So in today's video, I'm going to reveal how to prevent and eliminate kidney stones naturally and effectively. Part 1. Risk factors to prevent kidney stone formation. This part of the video is especially helpful to all people who suffer or have suffered from kidney stone formation. If you've already had this condition, chances are you're going to have it again if you don't do something about it, so pay close attention. Why does calcium or other acids build up in the body and later form stones in some people? Main reasons why these kidney stones can form include, for example, eating a poor diet, and especially that's high in oxalates like French fries, potato chips, or spinach. Taking synthetic calcium supplements, another one, for bone or joint problems, which aren't always absorbed well, and this is why I always advise my patients to look for organic supplements. Dehydration is another big one. People who don't drink enough water also form stones frequently. Inactivity, obesity, nutrient and mineral deficiencies, all of which can be prevented too. An abnormal pH balance, meaning the body becomes overly acidic, which can also be prevented through diet. Food allergies, chronic diarrhea, or having trouble with normal digestion are also risk factors. And other not so preventable risk factors, such as genetics, also plays a role. Thyroid or parathyroid hormone imbalances also. If you paid close attention to most of these risk factors, the great majority of them are entirely preventable through diet and lifestyle changes. And two that make a huge difference are diet and drinking lots of water. You can't go wrong with both of them. Number 2, how to eliminate kidney stones. Number 1, stay hydrated. This is very important, and many people underestimate its value. Let's think about this for a moment. If you're a person who has a high concentration of compounds that tend to precipitate in the kidney, well, you have a solution, and this solution can be that simple. Reduce the concentration of these compounds by increasing the volume of water you ingest. Another important reason to drink enough water is because any kidney stone that becomes lodged in the urinary tract can be effectively expelled by washing it out with water. The more you drink, the easier it'll become to wash it out. On the other hand, not drinking enough fluids can put you at risk for kidney stone formation, especially if you exercise a lot, live in a hot climate, drink diuretic beverages, medication, or even sweat a lot. Drinking enough water and plenty of hydrating fluids like tea, water, fruit water is even more important if you have a heavy sodium diet. Don't forget that sodium causes water retention and doesn't let you filter out that water that you need to wash out your kidney stones. So try to drink at least 8 glasses of water per day. Number 2, supplements. Supplements can be very helpful and beneficial if you develop kidney stone symptoms regularly. Some of these can even help you wash out the stones or trim down the sides of the kidney stones for them to be flushed out. Magnesium. Magnesium balances other minerals in the body, especially calcium, and prevents magnesium deficiency, obviously, or electrolyte imbalances. There are studies that show how magnesium supplementation can help trim down calcium kidney stones and prevent their formation. I recommend you take 250 milligrams of magnesium 2 times daily in a capsule. B vitamins. B vitamins help reduce calcium and oxalate accumulation. You can take a good quality B complex formula, especially one that contains at least 50 milligrams of B6, which has proven very helpful in this condition. Cranberry extract. Cranberry has hundreds of studies that prove its efficacy in reducing the risk of developing urinary tract infections, and obviously balancing out calcium levels also. If you're suffering from kidney stones, you have to be careful because the lodging of any stone can cause the backup of urine into your kidneys and cause a bacterial infection. In the time being, while you're trying to expel that kidney stone, I recommend you take cranberry extract or cranberry juice to prevent any serious kidney infections that will make matters even worse. You can take 400 milligrams of cranberry extract 2 times a day. Vitamin E. Vitamin E is a vitamin that is very useful in lowering inflammation and reducing calcium and or oxalate buildup. You can take 400 international units of vitamin E daily. Number 3, avoid calcium-containing foods. One very important thing to avoid are calcium-rich foods, but especially calcium supplements or antacids, because these can make matters even worse. It's now believed that calcium-rich foods themselves don't necessarily contribute much to kidney stone formation, although they always represent a threat. So, dairy, yogurt, kefir, beans, spinach are all foods to reduce in consumption. If you're necessarily taking calcium-containing supplements for bone health, joint health, etc., I suggest you take magnesium along with it to prevent the precipitation of calcium or oxalate stones. Number 4, castor oil. Castor oil is a vegetable oil used for a wide variety of cosmetic and medical purposes. In this case, castor oil has a special anti-inflammatory ability, useful in relieving pain associated with kidney stone symptoms, like for example cramping or muscle spasms. You can make your own castor oil pack by soaking a clean towel in pure castor oil and use this oil to press it onto the kidneys and allowing it to calm your symptoms. Another thing you can do is prepare yourself a hot compress over your kidneys several times per day to increase that blood flow and relax the tension over your muscles to help stones pass more easily. Number 5, change your diet. People, you have no idea how important diet can be. If you eat a poor diet, low in nutrients, electrolytes, and antioxidants, you're at a greater risk of forming kidney stones. Another important detail is that eating a very salty or high protein diet, or more than what you need, can result in the increase of ammonia filtration into the urine. All these factors are important because they play an important role in kidney stone formation. So instead, focus on eating a diet that can balance out the body's pH and prevent acidity. Fresh vegetables and fruits. There's research that shows how people who follow a plant-based diet tend to have fewer kidney stones than people who eat a lot of processed meat. And this includes packaged sodium foods and conventional dairy also. Foods that promote a healthy kidney function include bananas, leafy green vegetables, except spinach, organic fish, and sprouted grains. Alkaline foods. Contrary to what we might think, acidic foods like lemons, apple cider vinegar, and citrus fruits are strong alkaline forming foods. All these can help your body pass kidney stones at the same time prevent their formation. Vitamin E rich foods. Vitamin E is very useful to balance out oxalate levels and other toxins in the body, so foods like berries, almonds, olive oil, avocados may be helpful. Magnesium and potassium rich foods. Magnesium and potassium will help balance out those calcium levels in the body, so try to include bananas, leafy green vegetables, melons, except beets, spinach, or oxalate containing vegetables. Be careful. Help out the channel by giving this video a thumbs up and sharing it with your friends and family, and if you have any questions, leave your comments down below and I'll be happy to assist you. If you need a quality supplement for your disease or on an appointment, visit drlandevar.com. And right over here, I suggest you check out these other videos related to this topic. You're going to find valuable information that might prevent a serious health condition in the future. Thanks for watching, you guys, and I'll see you soon.